Okay, we're broadcasting. All right, welcome in. Thank you for joining. We are happy for you to be here today, and we'll just wait. We just launched the broadcast, so we'll give you a few moments to hop into the Zoom room. All right, welcome and thanks for joining us this morning. If you are new to us, we are the Family Caregivers of BC and the Alzheimer Society of British Columbia. And the webinar this morning is called How You Say It Matters, Strategies for Strengthening Communication with Family Caregivers. And for our presenters today, I'll get them to give you a little wave. Wendy Johnstone, who is a consultant with FCBC, and Mariana Hudson, who is also with us from Alzheimer Society. Thank you. And our guest speaker today, Erin Beaudoin, who is the CEO of Eden Gardens. And I'm Kate Landreth, the education lead with Family Caregivers of BC. So welcome in, thanks for joining. Just as a starting point, we'd like to share with you that all three organizations, so FCBC, the Alzheimer Society, and Eden Gardens are all nonprofit organizations who are supported by the BC government in different ways. However, we do not work for the health authorities or make decisions regarding care, services, or rules around visitations. And we're also aware that visitation changes have been made as of April 1st. And we will not be addressing those this morning, although we are happy for them. So just letting you know that we won't be discussing that topic or questions this morning. All right, webinar. If you are new to Zoom, I am going to launch a poll right now just so that you're comfortable with it, just to let us know who you are and what role you're in. And so you can select what one applies to you. Perfect, and I'll just share the results. So we have lots here as healthcare employees, welcome, social sector employees, and also a few family caregivers. So thank you and welcome. And you've just passed the test of the poll and how to use the poll. So thank you. And we'll be having one more poll in our presentation today for you to engage with us. And please note that the chat box will be an option to be able to answer with that poll, but it's just seen from our end as a facilitators, but you're also welcome to use the Q&A feature to ask questions. And you're going to remain muted this morning and your cameras will be off. I'd like to take a moment just to acknowledge right now the lands that I am working and playing on. I'm in the Songhees and Esquimalt First Nations community in Victoria, BC. So if you'd like to take a moment and just appreciate and give gratitude for the land that you work and play on and live on, please do that right now. And a little bit about Family Caregivers to start. So we are a nonprofit organization dedicated to the well-being of family and friend caregivers. We have been an organization for over 30 years now, and we're serving caregivers across BC since 2010. In the past 5 years, we are part of the Ministry of Health's Patients as Partners initiative. We have 3 pillars, as you can see on the slide. And the pillar today that we are looking at is engaging and collaborating with healthcare professionals and social service professionals. And our intention is to provide education on ways you can support and work with unpaid family and friend caregivers by first identifying caregiver, referring them to our organization, or Alzheimer's organization that can support them. And then also having that follow-up loop with the caregiver. And as always, you can check out our website to find more information on that.
Thanks, Kate. Good morning, everyone, and welcome. The Alzheimer Society of British Columbia is committed to supporting people affected by dementia across the province. We have support and education for people living with dementia, for family members, and similar to the Family Caregivers of BC, for healthcare providers as well. I encourage you to visit our website, www.alzheimerbc.org, for additional resources, including information that's specific to healthcare providers, such as our First Link referral program. And we have lots of resources as well on the COVID-19 pandemic, as well as our First Link Dementia Helpline, which you can call if you'd like more information for yourselves or for some new strategies that you'd like to discuss as well. Thank you.
Great. Thanks, Mariana. And last but not least, Erin, who is going to be our guest today. So thank you, Erin, for joining. She is the Chief Motivator CEO at the Eden Gardens since 2018. And she brings her knowledge and collaborative leadership style as she delves into all aspects of Eden Gardens facility. So Erin today will provide a balanced perspective of her experience and learning over the last year. And Erin, I'll let you unmute yourself if you want to share just a little bit about Eden Gardens.
Sure, thanks so much. Eden Gardens is a nonprofit long-term care home in Nanaimo. We are home to 130 elders who are living with dementia. And when our day programs open in times that aren't COVID, we serve about 160 people a month for 3 various day programs as well. We like to pride ourselves on following the Eden philosophy of care, which focuses on the fact that all elders are have a lot of wisdom to share with us and can continue to grow and learn, and that just because they're moving into a home in long-term care or living with dementia does not mean that their growth has ended. And I'm very happy to be here. Thank you for inviting me.
Thanks, Erin. And before we start, just so that you are aware of your kind of learning map ahead and what we intend for you to take away from this webinar together is the importance of communication between healthcare providers and family caregivers, especially during times like now, the pandemic, how to recognize burnout in yourself, in your colleagues, and in family caregivers, tools to help you strengthen your communication skills, and self-care strategies that can support you in managing challenging conversations. All right, I'm going to log off video and I'll let you presenters have fun.
Great, thank you so much, Kate, for that introduction. And I'll get us started today. So one of the key aspects of delivering person-centered care, which is best practice in dementia care and truly for any care recipient, is to involve the person and someone that they trust, whether that's a family member or a friend, in care planning or decision-making. Each member of the care team brings value and a unique experience. Creating those meaningful and respectful relationships between healthcare providers and staff, the person and families can actually improve the quality of life for everyone. In practice, however, teamwork isn't always easy, but setting clear expectations allows room for developing a better understanding. On this slide, I will show you a list of expectations that were taken from a video project that the Alzheimer Society of BC worked on with SafeCare BC. In the video about dementia care teams, we got an honest view from care home staff and family members about what they want the other to know about their expectations. So Kate, go ahead and click, thank you. So family caregivers in this project told us that they want staff to respect family members' input. They want staff to recognize that family members experience different feelings. We will discuss this point a little later on, but family members are experiencing all sorts of feelings of loss and grief when a person moves into a new place, for example, a care home. And with the pandemic, there's even more feelings of loss of control. Staff need to be mindful of these experiences and demonstrate empathy the best that they can. Now, thank you. Staff told us that they want families to recognize the rights of staff. They want families to understand that staff must try to respect the preferences of the person that they're caring for, as well as understand that staff also care. they care too. So Erin, we've discussed the importance of balancing family expectations of how a person should be cared for with the preferences of the person that they're caring for in the actual moment. Can you share an example of this in your practice?
Absolutely. I think when somebody moves into care, their loved one has been providing all of their support, and it's a big change having a bunch of other people that you may not have a chance to know yet take care of them. So one example that comes to mind is a woman who lives with us whose family were very insistent that she was dressed at a certain time and that she was wearing her bra all the time. And the woman, our resident, hated wearing her bra. It was something that often caused responsive behaviors, and we would try to redirect and come back and try again. But at the end of the day, the choice of our elder was that she was not interested in doing this. And only because we were able to build trust was that a conversation that we could help kind of have with the family and find a collaborative approach to respecting the elder and what their desires were today. But the family still needed to be able to express that their mother beforehand would be mortified to be found not wearing a bra in any kind of public scenario. So there has to be a lot of empathy and compassion and understanding through that. And the trust is what helps us have those kind of difficult conversations.
Absolutely. Thank you for sharing that example, and really kind of cements the last point in this slide. And Kate, go ahead and click on the next one, which is ultimately showing that building that trust, ultimately both the family member and the staff member really want the best quality of life and best quality of care for that person. Based on their role and relationship with the individual, of course, that will look differently. That will but acceptance from both sides is important to foster that positive relationship. Now, as staff in healthcare field, understanding what family members experience may experience can actually help you communicate better. So we'll go on to the next slide. Now, we recognize the impact of COVID-19 on your relationships with family members, especially around the topic of visitation. We'd like to share the following quotes with you from a family caregiver and a few healthcare providers. Now we'll start with a geriatrician here who shared their observations about family members who are struggling to cope while assisting their elderly parents through navigating our complex healthcare system and communicating with multiple healthcare practitioners. This healthcare provider recognized the importance of a family caregiver role and the role that they have in the system, and appreciation for the work that community organizations like ours provide. The family member in this slide recognized how stressful this time is, but how a friendly, positive, and helpful approach can go a long way. And Kate, go ahead and click on the next two quotes. And in the last quote that you see on this slide, a social worker tells us, it's heartbreaking to see the families experiencing so much pain and heartache. It's taking an emotional toll on the families and on us as healthcare workers. Our head understands what's going on, but our heart aches. Now, what all of these experiences tell us, and there's lots of more stories that we've heard from healthcare providers and family caregivers over the last year especially, but what they all tell us is that there is no doubt that this pandemic has been hard for everyone. There is an understanding that everyone is doing the best they can do, considering the circumstances. There is empathy for family members' experiences and the recognition of their role as part of the healthcare team and the healthcare system. And finally, there is an understanding that everyone wants the same thing for the person they're caring for, which is ultimately their quality of life. Go on to the next slide. So if everyone wants the same thing in the end, that is the best quality of life for the person, how do we get there? It's all about building trusting relationships, as Erin mentioned earlier, and achieving good communication is one way to do that. To illustrate a trusting relationship, let's think about the idea of a trust bank account by author Stephen Covey. A trust bank account is a metaphor that describes the amount of trust that's been built up in a relationship. It's really all about how you feel safe with another human being. When the trust account is high, then communication actually is easy, it's instant and effective. The less we invest in time and energy into building these trusting relationships with families, the more is withdrawn from the account. That means we've basically got less money to work with, which leads to less trust and poor communication. Erin, do you have anything to add here to this concept of trust bank account?
I think the more we can have positive and collaborative relationships with families, the better we're going to do all around. But it can be really difficult to do. One tip we try to do, and we don't do it nearly as often as we should or we could, is to call with good news. Often when you see a care home's number pop up on your phone as a family member, you automatically think the worst has happened. And too often we're only calling to say your loved one has fallen or they need a change in medications. And we're not taking the time to share the positive stories. And I think that makes a big difference for people who can't see inside these doors and they don't know what's going on here. And they're trusting us with the life of their, their mom or their dad or their spouse. The more positive things we can share, the more likely the families are going to see that there are good things that happen here still, even though it's been a tough year. And when we share them, they're happy that we care for their loved one.
Great example. Thank you for sharing that. So if our ultimate goal is to work as a team, then we need to do our best to communicate well so that we build up our trust account with our family members. So today we're going to look at how we can do that through communication. And we're going to start by looking at communication by just reviewing some of the basics. So here are 3 ways that we can communicate with one another. We start with our verbal communication, though that's just simply our words. And Kate, go ahead and click on the different, thank you. Our verbal communication, so that's the words that we say. And it's not just the words that we're expressing, but also through written language, so reading and writing. So think of our email communication here. Then there's nonverbal language. That refers to our posture, our body position, our touch, gestures that we give. And I'm demonstrating that now just as I express my words, our facial expressions and our eye contact. All of these are examples of how we communicate through our body. And finally, our paraverbal. So that's really referring to our tone, the pace of our speech. So are we quickly speaking to rush through a conversation or not, and the volume of our voice. Now, whether you're meeting with a family member in person or over the phone, it's really important to pay attention to how you're communicating with your words and your body language. Actually, all 3, including the paraverbal. On a phone call, the words that you say are important, but it's also important how you say them. Remember to smile, focus on your breathing, try to stay focused, and try not to multitask. So for example, try not making a call while you're on the floor, where you can easily become distracted. And the next part of this slide just looks at some things you should do and maybe things to avoid. So some things you should do when you're communicating is show that you're actively listening and paying attention to the person and to their concerns. Clarify statements that you don't understand. For example, I don't understand what you mean. Can you tell me a little bit more about what you're thinking? And also ask the person for feedback. Things to avoid include rushing a conversation, making assumptions about the other person, or just not being present in the dialogue. These are common culprits in miscommunication and in conflict. So now I'm going to turn it over to all of you again. We're going to do another poll here. We'd like just to take a couple of minutes to just get your thoughts on this question. What makes communication with family members difficult? In other words, what are the barriers for communication? So a poll will appear on the screen with several options. You can choose as many that apply to you as possible. And if you notice that none of these apply to you, then feel free to click other. And we welcome you to add your comments in the chat about what are some things that some of those communication barriers for you. So I'll just give you a minute here to respond. And Kate, I don't know on your end if you can see how many people have responded, but I'll just give it maybe a few more, maybe 30 more seconds.
Yeah, I'm giving it just a few more because I keep seeing numbers go up and down. So I'm going to end polling now. So last click.
Sounds
I'll
good.
share
Thank you.
the results with everyone.
Okay, it's excellent. Yeah. So, okay, 38% say the family dynamics is complex. That's the highest one among all of you that voted. And then this, we'll I'll go to I'm just reading out the top here. So the families need more time than I can give. And family expectations are different than mine. So those seem to be the top 3 that most of you kind of connect with. The other ones, not so much. And in the other, I'd love to welcome Carly is kind of overseeing our chat. Anything there, Carly, that we can add to the conversation about what may have come up in the other?
Hi. No, we haven't had too many responses. But we did have one piece of feedback, which is they could only select one, just as an FYI.
Oh, okay, good to know. Thank you. Sorry about that. That sounds good. So I'm sure if you had the opportunity to select multiple, I'm sure that multiple would have applied in your situation. So thank you very much for voting, participating in that. And we're not, of course, going to be able to address all of these challenges, especially the time one. I would love to be able to give everyone more time, but what we will look at is support you in ways that you can communicate. So that'll take us into our next slide, which just explores this a little bit further. So these are, we're going to take a look at some other factors that hinder communication. So some factors that pertain to both staff and family members include, and this is the first click, Kate. So when there, perfect, thank you. So the ones that you see on the slide affect pretty much staff and family members in different ways. So stress, burnout, grief and loss, and the general feeling that there isn't enough time. These experiences can manifest into feelings of worry, into anxiety and fear, stress, which can actually impact how we deliver messages verbally or through written or words, and also how we receive information. And this is through the phone, in person, and email, all of the different ways we communicate. Now, I do want to point out that for family members, in addition to the feelings of loss and grief that they experience as the person's abilities change, there are also feelings such as guilt that can compound their experiences. For example, the guilt that's associated with transitioning someone from home to a care home or into a hospital setting. Now, in addition to these regular factors that happen on a day-to-day basis, let's now layer on what COVID has added to the barriers to communication here. Now, I'm sure many of you recognize many of these, and I won't go into all of them, but what I do want to say is for staff, we've heard that it's been challenging to keep up with the changes in regulations. And here's another example this week. We have some new regulations that have come up. And deciding on what information to share with different stakeholders. On the other hand, the family members have needed to access more information about COVID, getting more updates on what's happening with the family member that they care for, because of the visitation rules or the fact that there's less opportunities for in-person communication. So as you've already experienced, the pandemic has created these additional factors that affect the way that you communicate with family members. So now that we've kind of taken a look at what these factors look like, let's go into some of these communication strategies that might be able to help you manage some of these factors. So we'll go to the next slide. In preparing for this webinar today, we came across an opinion piece written by Dr. Nakagawa, who's from the Columbia University Medical Center in New York, who shares his reflections on communication with families after his time during a palliative care rotation, where he found that breaking bad news to families was commonplace. Let's consider this quote. In pondering the best way to improve my communication, I returned to the methods that served me so well as a surgical resident. Of course, the tools were different. In surgery, the tool is a scalpel. In communication, the tool is language. Yet both surgical and communication skills have 3 steps in common: preparation, procedure, and review. So today we're going to look at communication as a process that involves these 3 strategies: preparation, procedure, and review. Next slide. Now, think about what you do before you speak with a family member, either in person or over the phone. Do you have a plan before you call someone? Now, a few things you can do are check in with yourself before starting a conversation. How are you feeling today? Is this the right time to be having this conversation? And what might make this conversation a little easier? For example, prepare a strategy that works for you, like using a script. Get the person's attention. In person, you can do this simply by just making sure that the person can see or hear you okay, but also check that you've called them at an appropriate time, and if you need to call back at another time. So some simple suggestions there. And finally, know the person. Knowing the person helps with being an empathic listener, and that is showing empathy and recognizing the feelings and the other person's perspectives. Consider the best way to communicate with the person. Maybe they're better over the phone than through email. And if it's possible, have the same staff member speak to the family member. I know that's not always the reality, but it does help with that building of trust if it's possible. And what is their experience like right now? Maybe they've called many times already with no answer, or something else is going on in their life. Remember that a loss of control is often coupled with grief and guilt, and this can make people respond perhaps in an angry or frustrated manner. Just like those we care for, they often aren't trying to give you a hard time, they're just having a hard time themselves. Now, Erin, I'd like to hear your insight here about what helps you prepare for a conversation.
I think, you touched on a bunch of really good points on being prepared and taking a moment to be in a quiet place and to take some deep breaths. I think in COVID too, we often get, it's hard to have perspective from somebody else's point of view and to put yourself in those shoes because we're all struggling. It's been one heck of a year for all of us, but thinking of the families being locked out and trying to understand how challenging that can be definitely helps with the empathy. I found myself for sure starting conversations in a very defensive place. I'm ready to be feeling attacked or have a disgruntled conversation. And it's my job to check that and to think about how can I change that? And so I've tried to make an effort to join other Facebook groups and things that I can gain family perspective of just as a fly on the wall so that I can step out of however I'm personally feeling and remember that the focus is on the elder. I mentioned earlier when the phone rings, they see the care home number, they're nervous. So answering right away and saying, hey, your mom's fine. I'm just calling to give you an update, checking in if the time is okay for them. This isn't an urgent conversation. Is now an okay time or do you want me to call you back? And then saying, if I can, taking a moment to see that elder before I make that phone call and say, hey, I was just sitting with your mom. She's having a really good day today. We just, played cards for a little while or talked about the flowers blooming or something like that. And it helps them recognize that I'm a human and their mom's a human and I'm here to help if I can. And even when they're difficult conversations, it sets a bit of a standard or a stage on having a calm and successful conversation.
Excellent. Those are great strategies for sharing. Thank you very much for that. Okay, so we'll move on to the next slide here. So we just talked about preparing for conversations. Now this is the procedure. What do you do during a conversation? And a lot of those things we just talked about, of course, you can apply to this part of your communication. Now, as many of you have likely experienced in the thick of a conversation, anything can happen. A family member or you may not be having a good day, or there might be many unexpected questions or comments that you're just not prepared for, you don't have the answer to. Although we've already discussed active listening and the importance of verbal and nonverbal language, it's good to repeat this message here. Demonstrate that you're engaged in the conversation and that you acknowledge the other person's experience. What I want to focus on this slide, though, is the empathy part. As we saw earlier, hearing quotes from healthcare providers and some examples that Erin shared with us, we know that staff care. Showing that empathy in that moment can be tricky sometimes, especially if in tough conversations. But we know that this is an important way to connect and strengthen relationships. Thinking back to the slide with the factors that affect communication, we identified that COVID-19 has increased family members' need for information and the experience of many emotions: fear, worry, anxiety, and the grief and loss. Have you ever noticed someone repeating their situation over and over to you? One possible reason for this is that the person doesn't feel heard. When someone feels unheard or dismissed, they will often say it multiple times and using different techniques to feel heard or understood. So this cycle starts to slow or stop when the listener acknowledges the speaker by simply saying something like, "This sounds very challenging and stressful." If you want to learn more about how you can demonstrate empathy, check out the Pearls tool that is referenced on the next slide and also in our resource document that we'll be sharing with you as well. We'll go to the next slide. Now, in addition to practicing ways to demonstrate active listening and empathy in your conversations, you might find using communication tools can also help you support your preparation and procedure. As you can see on this slide, there are many tools out there, so it's up to you to find the one that works for you. Ideally, you practice it enough that it naturally gets integrated into your conversations. Since we're going to be sharing links to all of these different tools with you in the resource document, I'm just going to focus on a couple. Starting with a simple question: what matters to you? According to the Guide for Conversation That Matters, produced by the BC Patient Safety and Quality Council, it can take just 90 seconds for someone to answer this question, which can really help set expectations in a conversation and demonstrate empathy. So if you're going through this webinar already thinking, I just don't have time to do any of these things, then consider a similar question in your conversations. And stop. Stop, such an easy thing to remember, but can be often hard to do in the moment. If you're having a reaction to something that the other person is saying, and Erin mentioned, feeling defensive in the moment, just take a step back if you can, or take a deep breath. Observe if you're in an in-person conversation, and just to take a time for collecting your thoughts. Remember, allowing time for a pause is okay. Erin, I'd love to just hear, what kind of tools do you use or you or your colleagues use?
I think I think what matters to you is really an important one, because when you have a person who has complex care needs and a whole life that they need to live, and a family member that's trying to represent and communicate that to us, the unfortunate reality is we often don't have time for everything. And so what can we prioritize? And if we can drill down into what matters for the family member, which is essentially what matters for the elder who may not be able to communicate that themselves, then we can say, hey, I can meet that goal, but I might not be able to get all the other things. And that's a good starting point. I also use SMART goals when I can. So they're specific, measurable, attainable, realistic, and timely. And hopefully Mariana will have a link in the resources as well we can share. And those are small little stepping stones that the more successes you can have, the trust builds, and we put more money into that trust bank. And then when something maybe does go wrong, or we have some unfortunate news or a difficult conversation we need to have, we've built up some rapport with individuals that help them trust that we're here to do the best that we can.
Wonderful. Thank you for adding those. Okay, and then after we've gone through the preparation, the procedure, now it's the time for the review. Now, no matter how the conversation with the family member goes, spending 3 to 5 minutes or more, if you do have that time, afterwards to follow up, debrief with a colleague, and reflect how it went can make a really big difference in future conversations. I'm going to pass this one back to you, Erin. What would you recommend sort of at this review stage? Anything to highlight here?
Yeah, I think the debrief parts are really important to managing our own burnout as caregivers as well. I know that we just go for 8 hours a day and then have full lives outside of our home as well. So taking a moment to debrief, if possible, debriefing with a leader. We want to be conscientious that when we have perhaps a bad experience that we want to let off our chest, we're not cycling into a gossip area. So I'm talking to my colleague, and maybe my colleague has never met this family before, they're new, and I'm complaining or I'm venting about my experience. We don't want that to then become a secondhand experience for that other colleague who hasn't had an opportunity to build any rapport with the family. So if possible, debrief with a leader in your organization. I know that's not always easy to do, but if you can, that's great. If you can't, you could preface your conversation with something along the lines of, I just had a difficult conversation. I don't want this to follow the family, but I really need to get it off my chest and I just need to vent about it. And then you've set the stage again for the ability to kind of have an open and honest conversation about how you felt about something without attaching any kind of stigma or label to a family member when those partnerships are really imperative.
Absolutely. And I think another thing we talked about at one point was charting, and how important it's not just that in-person debrief, but it's also communicating that to the other people that are going to be supporting that person in the future. So if you've learned something from that conversation with that family member, for example, if the family member is maybe going through something else in their life right now, and you want to show that empathy in the next call or the next conversation, that's really good to chart.
Absolutely.
Awesome.
Yeah, thank you for bringing that up, Mariana.
No
Charting
problem.
is imperative, and we're really good about doing that in between our shifts and our Passovers, but perhaps we don't always think that family relationship is as imperative. And you're absolutely right. If it's saying somebody, so and so has been in the hospital and they can't visit their husband, and then you get a phone call from the wife who's frantic because she hasn't heard anything, you can say, "How are you doing?" and ask her a question about her own well-being, and that goes for a little empathy and caring.
Wonderful. Thank you for that. Okay, so just the last slide we want to show here in this summary slide, and we'll just show all three things. Kate, go ahead, and we won't have time to go through all these. This was sort of going to be an example, but just putting everything together, putting all the strategies together, the preparation, procedure, and review. I encourage you to review the resource document that contains links to the information to work on improving your own communication practice. And now I'll pass it on to Wendy.
Thanks, Mariana. We thought it would be helpful for us to talk a bit about the caregiver trajectory, as it really gives context to the lens of the caregiver and where they're at within their aspect of caring and journey of caring, and how that can impact communication. So as we all know, caregiving is a very dynamic role, and it changes. It's not formulaic, but typically as caregiver demands increase, so does the impact on the caregiver. So the longer the caregiver has to care, and as the disease progresses, the risk of distress and burnout is directly correlated. So understanding where the caregiver is along the trajectory is often really helpful to best support them, what to communicate with them, and to understand the emotions that can accompany where they're at. So, for example, new caregivers, typically there's a huge amount of awareness of their role or of the disease process, or what's going to be expected of them. And they often need a lot of information and resources and support on how to navigate a healthcare system, or how to navigate or better understand a prognosis or a disease trajectory. With unfolding responsibilities and increasing care demands, what we see is that this is where caregivers do start to burn out, or they start to experience more distress. They often need access to more personal support for themselves. The person they're caring for often needs more support. The emotional component and support of how they're doing is often a critical aspect. Validation of their feelings, of their role, of their decision making, especially with tough decisions, are an area that often caregivers speak to us about. Transition, so end of life, or transitioning to long-term care, they often represent that reality of the loss, both for the caregiver and the person being cared for. And, layered amongst this trajectory are all the other emotional aspects that come with caregiving: guilt, anger, resentment, and all of this can really affect communication strategies or how that individual is feeling. And so I think bringing awareness into understanding even where the caregiver is at along the trajectory can also help give context to some of the conversations and the lens in which both of us are, seeing the care of the person, or the client or the patient. Thanks. The impact of caregiver distress is something that is being widely studied right now. And currently, as we know, the BC Seniors Advocate is tracking distress. And in 2015, 27% of all caregivers indicated they were distressed. In 2017, that's up to 31%. We can only imagine what those distress rates are currently. The other really interesting statistic is that caregivers who have chronic health conditions, are twice likely to be distressed than the general population. There are many things that contribute to burnout and distress. And so despite the deep commitment to their caregiving roles, many caregivers, who are caring for someone that has high care needs are, experiencing feelings of high demands for themselves, and perhaps sometimes this expectation from a healthcare system that can or can't deliver what they think it should. And so this gets compounded in communication, in how the person's being cared for, and in the whole emotional and physical well-being of the caregiver. So this idea of unrealistic expectations for caregiver self-care is also, I think, a really important point to be made, that healthcare providers ourselves and family caregivers share this risk factor. So even though the research highlights that caregiving can equate to poor health, self-care is now added as a responsibility. And so it's one more responsibility as a healthcare provider or family caregiver that we're now thinking about, even though we already know that it's important. And I want to bring that up because I think it also it's this interesting dichotomy with caregiver distress. Most caregivers, family caregivers, and healthcare providers recognize that they're having a difficult time, managing both their caregiving responsibilities and their responsibilities to family, and also to themselves. Next slide. This particular source, I just want to bring this up because it's something we've been working on, Family Caregivers of BC, with the Powell River Division of Family Practice, and they're working on this wraparound service for fail seniors and their caregivers initiative. And this was, typically a tool or a visual for clinicians to use to recognize caregiver burnout flags. And so we just really wanted to highlight that caregiver burnout just doesn't always apply to family caregivers. It also applies to colleagues. It also applies to ourselves. And so all of these components, really what they translate into, that when we are feeling more distressed, or we're feeling as though our role as a caregiver is starting to really infiltrate other parts of our lives, that we can easily become more irritated and angered, that we have less control over our emotional responses. It takes a lot more energy to remain, calm and collected. We can have changes in our sleep patterns. Our immune systems can become weakened. We can experience physical changes. So we're seeing more physical signs of stress. And all of this affects our energy and capacity within our role, but also when we are having to engage in communication that may or may not be that typically are sort of more difficult conversations with family caregivers. And so all of this, can also again affect that. So having awareness of where we currently are in terms of our own health and well-being can also help give indication to where we might want to focus our energy or our space when we are communicating with others. Over to you, Mariana.
Great. Just popping back on for just one more moment here. Kate, go ahead and show all of the bubbles here. So earlier we spoke about how we communicate with others, but it is also important to check in with ourselves and to reflect on how we speak to ourselves, because that matters too. You matter. If your inner thoughts tend to be more negative, then you will often feel worse about yourself and just your situation in general. It often becomes harder to pick yourself back up and move on. Developing more positive self-talk habits can have a positive impact on your well-being and how you feel about yourself. So these are some of the ways that some of you may relate to, that you talk to yourselves. I don't have time. I promised her I would. I just can't handle this. A more positive or self-assuring way to speak could be, one step at a time. I can do this. It's okay. She will understand when I tell her about it. Or I'll try my best. Tomorrow is another day. Erin, I know that this has been something that you've been mindful of in your workplace. Did you have any other suggestions here?
Two, actually. One of them was throughout the pandemic, our leadership team and many members in our organization have taken a lot of webinars on resiliency and how to keep a balance in this really stressful world. And all of it was about balance. And you have to make sure that you've got both sides. You've got your life and I know, and your work on one side. But the reality was there was no balance in COVID. It was just trying to keep people safe and keep people alive and do the best we could in an ever-changing world. So a tactic that I adopted when I realized that I just felt like I was failing every time I went to a resiliency workshop, I felt like I was failing at being balanced and resilient, was just to forgive myself. And just like the bubble says, I just do the best I can every day. And some days that just doesn't make the bar, and that's okay. Maybe I'll do better tomorrow. Another thing, partway through the pandemic, I'm a fairly vulnerable leader. I'm pretty honest about how I feel about things. And when I struggle and make mistakes, I'm not one to pretend I haven't. But I went through a small stage of saying, I'm going to admit to people where I'm at. So when they ask me, how are you? I'm like, I am not good. I got to be honest, I'm just not good. But then I started telling myself I wasn't good. And then my mind started continuing down a negative pathway. So the whole fake it till you make it thing sometimes helps that positive mindset. And I wasn't trying to not show vulnerability to my teams, because there were days we weren't good. But the more I told myself that it's okay, the sun's shining, life goes on, there are positive things, the better I could genuinely smile. And I actually realized that being too honest about some of the way I was feeling was dragging me down. So that fake it till you make it kind of sold me on a positive swing.
Thank you very much for sharing that, Erin. And back to you, Wendy.
Thanks. So we wanted to focus on what we have found and what we have heard from other healthcare professionals around ideas of our own self-care. And I know that word is thrown around a lot, but this idea of know your limits. So set your boundary, and setting boundaries and being resilient, they certainly go hand in hand for both family caregivers and for healthcare professionals. I think all of us as human beings. And it's really about recognizing the importance of our own lives and family, a meaningful purpose in our work, and it's striving towards caregiving and doing our assigned tasks and roles and jobs within those limits. So it doesn't mean that we aren't dedicated to our work or to the people that we're caring for. Rather, boundaries are a sign of real self-respect to allow us to continue caring with compassion and devotion, and to not feel lost or swallowed up by the caregiving role. I'm just going to give one very personal experience. So one of my roles is caregiver coaching, and there were days where I would receive maybe 5 or 6 calls from caregivers, and we do coaching sessions, and they're a pretty intense 60 to 75-minute conversation. And the stories I heard were really hard. And so, part of that role is absorbing all of those emotions and all of those challenges, and then trying to be this really pragmatic strategy, empathetic, caring individual to come up with possible, solutions, or to support that caregiver in making a plan for themselves. And there were some days where I was just so exhausted, and I just had, so much angst around not being able to service and really support these caregivers on the phone, and what was going to happen to them after the phone call ended. It was really challenging. And I remember thinking, okay, this idea where every day I can't just do that for six calls in a row. It's not gonna work. And sort of came back to some of the activities that I would often talk to caregivers about and say, okay, well, what are your non-negotiables? So what's most important to you? And having just even that one boundary for myself was a real go-to every day. And I wrote it out, and it's on my wall, and it's still on my wall. And the non-negotiables for me are 60 minutes of physical activity a day, and not compromising my sleep. And it is as basic as that. And if I hit both of those, it just felt like I was able to continue in my role. So that's one thing, is what's most important to you. This idea of even just making yourself a quick list, or having your 2 bullet points on a wall that you can see. For some of us, sometimes it's a daily self-care practice. It might be even just 10 minutes or 15 minutes. And so one thing I would certainly encourage you to share in the chat box is to ask yourself, what are your non-negotiables, and share those with others, because often it's really helpful to hear others as well, what we're doing collectively as a group. I think we can go to the next slide. That's great. I think this idea of, practice makes perfect. I think it's a bit hard to strive, for perfection. I think all of us are striving for perfection. But this idea that there are a few things that we can do within, 5 minutes every day. And one of the things that, we were talking as a group, in preparing for this webinar, is this idea that this daily check-in with ourselves. So checking in with ourselves at the start of the day, and even throughout the day, can really help bring awareness to the feelings that we're experiencing throughout our day. I have a personal practice where in the morning I take, 5 minutes, and it's just to write 2 or 3 things I'm grateful for, and to kind of give myself a general, like, am I feeling my usual 100%, or is it, a 40% day? And that kind of helps also give me permission to know that I'm a human being. I'm going to have really good days and not so great days. And at the end of the day, I really try and focus on what was one of my wins. Is there anything I'd like to bring forward? And also, again, to practice gratitude. Erin spoke about words of affirmation, and I think that that's really important. Being really kind to ourselves, and whatever words those are. I sometimes I can be a very intense person and take things really seriously. And so, I have a little sticky that says like, keep it fun, Wendy. Don't always have to be intense. And, up here, you can just let loose a little bit and have a little fun. This whole idea of expectation exercise is another one. And this is a really, I think, high level one, but this idea of setting realistic goals for ourselves. So I often use this with family caregivers, this idea of, what's the worst possible scenario? What's the best possible scenario? And what is acceptable, or what can I live with? And that can be, I think, with a lot of aspects in our life, whether it's parenting, in our relationships, in our work, in our physical health. And I touched on the idea of gratitude journaling at the start because it's tied into my daily check-in. But there's been a lot of work and a lot of studies done recently around journaling and how much of a positive impact it can have on just bringing awareness into how we're feeling and our mental, overall mental and physical well-being. So again, it would be great if you can share something that's working for you right now, or even think about one thing that you might want to try this week. You can go to the next slide, thanks. Oh, and sorry, I just spoke to that on the slide.
Perfect. I was going to say that. Thanks, Wendy.
And Irene just said, I just missed that, but every day is, a fresh day. And I think that's such a wonderful, that's a wonderful words of affirmation. So thank you for sharing that.
All right, I realize we're 5 minutes over. There is so much good information in this presentation, and we really worked hard to condense. And I know that each of our presenters had lots to share. Mariana and Erin, if you want to pop on just to show your faces again. I'll wrap up. Carly is going to put in, first, there's lots of questions of, is this recorded? Yes, it is. Are the slides available? Yes, they are. And also the resource lists that we've been mentioning, both of communication, self-care, we have that made for you. And then also a resource list of both of our organizations and supports for family and friend caregivers. And so in the Zoom link that you signed up today, tomorrow and a day later, there'll be a confirmation at the end that will send you all these links. And then Carly will also put in the chat box if you want to copy and paste any of the links immediately, feel free to do that now. And we also have an evaluation that will go out in the form of a survey, just asking for your feedback. So your feedback on our presentation today, if there's any other educational topics that you would like to learn around family and friend caregivers, we are really interested in hearing back from you as it informs our educational plan with healthcare providers. So thank you. And Mariana or Wendy, if you have anything to add, please do. I'm going to put up our slide as well of our contact so that you can catch that as well. Lots of information on our websites. I've been looking a bit just in terms of Q&A as we've been going through, and I answered a few just in the recording. And Nancy, thank you for your comment. Just a great tip that she read recently is a study showing that getting caregivers to set an alarm, to stop 5 minutes a day, take 3 big breaths can really support their cortisol level, their stress. I think that could be for everyone, and I so appreciate that technique. So thank you for sharing that. All right, so being mindful of time. If there are any questions and you want to drop them in the Q&A or the chat box, please do, and we're always happy to respond to you personally. And we appreciate your time and for you joining this morning. And as always, it's been such a pleasure, Mariana and Erin and Wendy, to all collaborate together. And until next time, please take care.
Thank you very much, everyone.
Thank you.
Thank you, everyone.